Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello, good morning everyone. Good morning moms. My name is Bulan Bunaristi. I'm here today to explain about delivery a baby. This talk is divided into two main parts. First, definition of delivery a baby. Second, different kinds of childbirth and delivery methods. Okay, my presentation will take approximately 10 minutes. Okay, are you ready, moms? Firstly, I'd like to look at the definition of delivery a baby. Delivering baby few things in life are more exciting than the baby birth of a new baby. This has been the case throughout human history, but childbirth options of new mothers have advanced to make the experience safer. Medical technology has made childbirth a much safer experience over the past century for both mother and baby. Uh, Hospitals have responded to trends in childbirth, such as the need for a more home-like environment in the hospital. Many hospitals now offer comfortable maternity suites that convert into state-of-the-art delivery rooms. An easy birth and a perfectly executed birth plan are ideal. However, we know that even the most carefully planned birth can take twists and turns. In this case, it's important to be prepared for alternative delivery methods. Okay, let's now move on to the next slide. Secondly, I'll be talking about different kinds of childbirth and delivery methods. First, vaginal delivery. Second, cesarean section or C-section. Third, vaginal birth after cesarean. Fourth, vacuum extraction. And last is forceps delivery. Okay, next, first is vaginal delivery. In a vaginal birth, the baby is born through the birth canal. It's hard to know when exactly you will go into labor, but most women give birth at around 38 to 41 weeks of pregnancy. The National OB/GYN organization recommended that pregnant women plan for vaginal birth unless there is a medical reason for cesarean. In new guidelines issued in 2013, the American College of Obstetrical and Gynecology says maternal request cesareans are especially not recommended for women planning to have several children, although they be performed before 39 complete weeks of pregnancy. Let me show you a benefit of vaginal delivery. Benefit of vaginal delivery. First, shorter hospital stays because it doesn't need special care such as cesarean. According to according to Dr. Alison Bryan, a perinatologist from Massachusetts General Hospital in Boston, also it depends on the condition of the mother and child. In general, if the mother is judged to be quite healthy within 24 to 48 hours, the mothers can leave the hospital. Meanwhile, mothers who gave birth by cesarean were allowed to go home from the hospital after within 5 to 6 days. Second is lower infection rate. And third is quicker for recovery. The recovery time for vaginal delivery mothers is generally different. However, generally the normal postpartum recovery time is 2 to 6 weeks. Recovery after a cesarean section can take up to 2 months. However, this process will be easier to achieve if you take good care of your body. The last is babies born vaginally have a lower risk of respiratory problems. Okay, next, secondly is cesarean section or C-section. Of course, we know that not all births happen the way we plan. When complications arise, other methods of delivery are available. Okay, we can see in this slide a cesarean section or C-section is delivery of a baby through a surgical incision in the mother's abdomen and uterus. in certain circumstances, a C-section is scheduled in advance. In others, it's done in response to an unforeseen complication. There are several things that are possible for C-section. Let me show you events that may require C-section. Events that may require C-section. First, multiples, twins or triplets, and etc. Also, twins can be delivered through vaginal delivery. In some cases, a cesarean section is necessary. This is influenced by fetal position, number of pregnancies, fetal weight, and gestational age. Usual pregnancies with triplets or more have a lower chance of successful vaginal delivery. The next is a very large baby. This can happen when the baby size is too big, when the mother's pelvis is small. Third is previous surgery, C-section, or other uterine condition. In fact, 90% of women who have a previous cesarean section may have a vaginal birth after cesarean or VBAC. However, there is still a risk that can occur in VBAC, namely uterine tears. Therefore, there are several conditions that must be met before pregnant woman perform the VBAC procedure. Okay, the next is baby is branched, bottom first or transverse sideways position. When the womb is 32 to 36 weeks, the fetus is usually in a position ready to be born, namely the head at the bottom of uterus towards the birth canal. However, sometimes the position of the fetal head is still in the uterus even though it is approaching the time of delivery. Okay, the next is placenta previa. When the placenta is low in the uterus and converts the cervix. This condition occurs when the placenta attaches to the underside of the uterine wall so that it can completely or partially close the door of the cervix to the uterus. In the case of placenta previa, observation shall be made before performing a cesarean section. Not all, not all, not all of these conditions require a cesarean section. However, in general, placenta previa that covers all or part of the cervix requires a cesarean section for delivery of a baby. Okay, the last is fibroid or other large obstruction. Obstruction of the birth canal by fibroid or tumors, the most common problems that can be experienced by pregnant women due to uterine tumors are premature births, tumor blocking the birth canal, breech babies, and placenta absorption. This various problem can prevent pregnant women from giving birth normally, so cesarean section is the safer method of delivery. Okay, I now want to go to vaginal birth after cesarean. In the past, a C-section needed any hope of future vaginal delivery. But today, thanks largely to change in surgical technique, VBAC is possible in many cases. In fact, an estimated 75% of women who try VBAC have a successful vaginal delivery. VBAC is not right for everyone. Sometimes a pregnancy complication of underlying condition prevents the possibility of a successful VBAC. Many hospitals don't offer VBAC because they don't have the staff or resources to handle emergency C-section. Okay, let's now move on to vacuum extraction. A vacuum extraction is a procedure sometimes done during the course of vaginal childbirth. During vacuum extraction, a healthcare provider At least the vacuum, a stuff of fried cup with a handle and a vacuum pump to baby's head to help get the baby out of the birth canal. So far, we have looked at this slide. Now I'd like to move on next slide. Okay, the last point is horseback delivery. Horseback delivery is a type of operate vaginal delivery. It's sometimes needed in the course of vaginal childbirth. In a horseback delivery, a healthcare provides a place for safe and instrument safe like a pair of large stones or slit tongues to the baby's head to help guide the baby out of the birth canal. Okay, I think it's enough. And I'd like to finish by emphasizing that each delivery method has its own advantages and disadvantages. We just need to do best while under any circumstance for the safety of our baby. Thank you so much for your time and your attention. I hope we are always in good condition. Stay healthy and see you next time. Wassalamualaikum warahmatullahi wabarakatuh.